Your doctor just told you that your blood pressure is a little high during your pregnancy checkup. That news can be a bit scary and confusing. What does it actually mean for you and your baby? Is this the same thing as preeclampsia that you might have heard about? Don't worry, we're going to clear everything up. I'm Alvin, and today, we're demystifying gestational hypertension, giving you the knowledge you need for a healthy and safe pregnancy journey. First things first, what exactly is gestational hypertension? In simple terms, it's high blood pressure that develops for the first time after you're 20 weeks pregnant. The magic number doctors look for is a reading of 140/90 mmHg, or higher, on 2 separate occasions. Now, a crucial point here is how it differs from preeclampsia. With gestational hypertension, you have high blood pressure, but you don't have protein in your urine or other signs that your organs, like your kidneys or liver, are being affected. That's the key distinction. However, and this is why your doctor is taking it so seriously, about 1 in 4 women who develop gestational hypertension will go on to develop preeclampsia. This potential progression is the biggest concern, which is why close monitoring becomes the absolute priority for the rest of your pregnancy. It's all about staying one step ahead to keep both you and your baby safe. So, what does this close monitoring look like in practice? Get ready to see your healthcare team a bit more often. Your management plan will likely involve more frequent prenatal visits, sometimes weekly, to keep a very close eye on your blood pressure and check for any developing signs of preeclampsia. Your doctor might also ask you to start monitoring your blood pressure at home. This is a fantastic way to stay on top of things between appointments. If you are monitoring at home, getting an accurate reading is key. Here's a quick guide. Find a comfortable chair, sit quietly for about 5 minutes before you start. Make sure your feet are flat on the floor, your back is supported, and your arm is resting on a table so the cuff is at the same level as your heart. Don't talk or cross your legs. Following these simple steps ensures the numbers you get are reliable, which helps your doctor make the best decisions for your care. Beyond just checking your blood pressure, your monitoring will also focus heavily on your baby's well-being. Expect to have more frequent ultrasounds. These aren't just for cute pictures. They are vital for checking on your baby's growth. High blood pressure can sometimes affect the blood flow to the placenta, which can slow down growth. Regular scans help ensure your little one is thriving. You might also have something called a non-stress test, or NST. This is a simple, non-invasive test where they monitor the baby's heart rate to see how it responds to movement, giving a good indication of their overall health and oxygen supply. Now, what if your blood pressure stays stubbornly high? That's when medication might come into the picture. It's important to know that there are very safe and effective blood pressure medications that can be used during pregnancy. Your doctor will choose the best one for you, but some common options include labetalol, which is a beta blocker, and often the first choice. Another one is nifedipine, a calcium channel blocker that works by relaxing your blood vessels. And then there's methyldopa, an older medication with a very long and proven safety record for use in pregnancy. The goal of these medications is unnecessarily to get your blood pressure back to a perfect pre-pregnancy number, but to keep it in a safe range to prevent complications for both you and the baby. While medical management is crucial, there are also so many things you can do to help manage your blood pressure through lifestyle adjustments. Think of these as your supportive co-pilots on this journey. A balanced diet is your best friend. Focus on eating plenty of fruits, vegetables, whole grains, and lean proteins. It's also a good idea to pay attention to your sodium intake. You don't need to eliminate salt completely, but avoiding highly processed foods, canned soups, and fast food can make a big difference. Gentle doctor-approved exercise is also incredibly beneficial. We're not talking about training for a marathon here. Simple activities like daily walks, prenatal yoga, or swimming can help manage blood pressure and reduce stress. Speaking of stress, finding healthy ways to manage it is more important than ever. Whether it's through deep breathing exercises, meditation, listening to calming music, or just taking quiet time for yourself each day. These practices can have a positive impact on your physical and mental well-being. Always remember to discuss any new diet or exercise plan with your doctor first. One of the most critical parts of managing gestational hypertension is knowing the warning signs that it might be progressing to preeclampsia. Being vigilant can be life-saving. Pay close attention to your body and contact your doctor immediately or go to the hospital if you experience any of these symptoms. A severe headache that just whoa and go away, even with pain relievers. Any changes in your vision, like seeing spots, flashing lights, or blurriness, sudden swelling, especially in your hands and face. And finally, a sharp pain in your upper abdomen, usually on the right side, right under your ribs. These are red flags that need immediate medical attention. Don't ever hesitate to call. It's always better to be safe and get checked out. Sometimes, despite everyone's best efforts, with monitoring, lifestyle changes, and medications, the blood pressure might become very difficult to control, or there might be signs that the baby is under stress. In these situations, the safest option for both you and your baby might be to deliver. Your doctor may recommend inducing labor. The timing of this decision is a careful balance. The goal is always to keep the baby in the womb for as long as it is safe, allowing them more time to grow and develop. But the moment the risks of continuing the pregnancy outweigh the benefits of waiting, delivery becomes the best course of action to ensure a healthy outcome for everyone. After delivery, your blood pressure will still be monitored closely. For most women with gestational hypertension, their blood pressure returns to normal within a few weeks or months. However, having had it does put you at a slightly higher risk for developing chronic high blood pressure later in life. So it's a good reminder to continue those healthy lifestyle habits long after your baby is born. Navigating a diagnosis of gestational hypertension can feel overwhelming, but you are not alone, and you have so much power in this situation. Your most powerful tools are knowledge and communication. Know your numbers, attend all of your appointments, take your medications as prescribed, and never ever hesitate to communicate any new symptoms or concerns to your healthcare team. By being an active and informed participant in your care, you are doing the absolute best you can to ensure a healthy pregnancy and a wonderful healthy outcome for you and your baby. Thank you so much for watching. If you found this video helpful, please give it a thumbs up and consider subscribing for more content to help you navigate your pregnancy with confidence. Stay healthy, and we'll see you in the next video.